Hello everyone. My name is Ranjit Kumar. Uh, Configuring Healthcare. Welcome to my presentation on Cognifying Healthcare. Today I will explore how Kevin Kelly's technology force and Cognifying or transformation healthcare industries has highlighted in the inevitable cognizant represented in the integration of articles intelligence into the virtual every asset. Mm, represent the integration artificial intelligence into the healthcare standards at the forefront of the resolutions marketing it ideal lens through which is examine both current impacts and future possibilities. My analysis will cover current applications, case studies, benefits, challenges, data driven insights, and future projects. By understanding this technological force, we can better prepare for healthcare landscape that will be dynamically different within the next decade. Let's explore how cognitive technologies is not just changing the healthcare delivery but fundamentally reshaping our understanding of medicine itself. From the slide one, introduction to the cognifying as described by K.V. Kelly represented the infusion of the artificial intelligence across all the industries and the aspect of the life. This technical force is not simply about adding computer power, it's about embedding actually intelligence into the system and the object around us. In healthcare, cognifying means transforming a passive medical devices into the proactive diagnostic tools, converting standard procedures into the precision medicines, and shifting reactive care and predictive interventions of medicine learning into the medical decisions making has already begun reshaping how diseases are diagnosed or treatments are developed and patients care is delivered. This evolution goes beyond the animations to care the systems and can learn, adapt, improve over time. That human computer interactions in healthcare is transformed from the basic digital tools and collaborate the intelligent systems that enhance the rather than the placement human capacities. And coming to the slide healthcare industries current and impact. This healthcare industry is experiencing dramatic transform through the cognifying the technologies. AI diagnostic systems now routinely outperform human radiologists in detecting early stage cancers and other conditions from the imaging data. Robotic surgical systems like DA Vinci platforms allows the minimally invasive procedures with unpredicted precisions, reducing the recovery times and complications. The rise of the algorithms driven personalized medicines means treatments can be tolerated and individual diagnostic profiles, moving away the one size fits all the approaches. Variable monitors having involved from simple step counters to health monitoring systems that can detect the irregular heartbeat, sleep, even early signs of infections. Meanwhile, admissions efficacy has the proven dynamically as AI automates scheduling, billing, and electronic health record management. These developments are not a merely incredible improvements, but represent a fundamental shift is how healthcare is concerned about the delivery. Case study in healthcare. IBM Watson's oncology applications demonstrates AI power in the diagnosing rare the complex cancer cases by analyzing the million of medical papers and the patient's records to recommended treatment options that human doctors might miss. Google DeepMind's kidneys injury protection systems has proven remarkable accurate at identifying the patients at risk at acute kidney injury 48 hours before symptoms appear, giving doctors crucially time to intervene. Providence Health Systems implementation of the AI power schedule has reduced no-show rates by 20% and optimizing the power name Finally, the surgical robotics like those used in the Johns Hopkins have demonstrated measurable diseases in complications during the complex procedure, showing that cognitive technology is directly improving the patient's outcomes beyond the just efficiency gains. Coming from the slide 4, uh, positive effects of the cognifying, the integration of the cognifying technologies into healthcare delivers several transformative benefits. First, AI powered the screening tools can detect diseases at early stages than the human physicians alone, the particularly for the conditions like cancers, where early interventions dynamically improves the several rates. Second, the automation administrative task and the optimizations of the resources has begun to reduce an astronomical cost of healthcare delivery potentials, make care yet accessible to understand the population's third medical knowledge. Democratizations through the AI power diagnostic tools measures the high quality medical advice and become the available beyond the major medical centers, reaching rural and developing regions. Fourth, AI systems as helping the addressing the physician shortage by handling the routine cases and providing the decision supports, allowing doctors to focus on complex cases, recruiting the human judgment. Finally, AI enhance the treatment planning, incorporates visual more data points than human possibility, creating the truly comprehensive care approaches in the individual patient's profile. Coming from the slide 4, potential negative consequences described promise cognifying the healthcare industry significant challenges. The massive collections on sensitive health data creates the unprotected privacy vulnerability that could affect the insurance eligibility, employment, and lead discrimination. Technology access, the departments may be widen existing healthcare gaps, creating an two-tier systems where only affluent patients benefit from the advanced cognitive technologies. Medical professionals face potentials displacements, and AI systems like over diagnostics and administrative functions requiring painful professional transitions, and the rising questions about the maintaining human medical expertise. Orleans algorithms create the risk and outside training placements, all these things, face-to-face interactions between the providers and the patients. These challenges demand thoughtful solutions along with the technical advancement. Coming from slide 6, data-driven analysis, statistical evidence strongly supports the cognifying and transformative healthcare impacts. Recent peer-reviewed studies demonstrating a diagnostic platform that's achieving 94% accuracy across the multiple conditions categorical, often exceeding the specialist physician's performance. Implementation cost have the decreased dramatically with 40% of reduction since 2020 as technological mature on the scale. Rural communications has been 250% increase in the telemedicine's adoptions, incorporating AI dynamic assistant helping the address the presented geographical disappointments in care access. Patient acceptance is 78% is survived patients expressing comfort and AI augmented healthcare when properly explained. And finally, this conversion, the improving technology performance, decreasing cost, increasing adoptions, and massive capital investments, and create the movements that virtual guarantees cognifying will continue reshaping healthcare regardless of the individual stakeholder reservations. Yeah, future version 2030. By 2030, cognifying will push healthcare towards the predominant dominantly preventations model, advanced AI, and that detect the diseases precautions before the symptoms emergency, using combinations of genetic, behavioral, and environmental data to predict the conditions years before the conventional diagnosis. The engaging global populations will increasingly rely on robotic conversion monitors whereas the doctor's role with involved is partners with AI systems, interpreting complex cases, providing the human judgment and communication the patients, while AI handles routine diagnostics and monitoring. Uh, but to understand the population worldwide, the version represents not just technical advertisement, but a fundamental reimagining of healthcare purpose and delivery. Conclusion of the recommendations for the cognifying fulfill the healthcare the potential. Several implementation emergent. First, robust the ethical frameworks must be developed specifically for the healthcare. AI address unique medical concern around the autonomy, beneficence, and justice. The second, careful attention must be paid to preserve a meaningful human consultation along with the technical advertisement, recognizing healthcare and inherently relational nature. The third, medical education requires comprehensive redesign and prepare the professionals for the effective human AI collaborations rather than the competitions. Fourth, regulations approach must involve the technological piece while using the approach safeguards, avoiding the post-stakeholder implementation and the innovation or regulations. Finally, the perhaps the cognifying may ultimately create more human healthcare by automating the administrative burdens and routines, the focus, empathy, complex, and judgment relationship building. Cognitive technologies, but doing is nowadays the enhance rather than the diminish healthcare's fundamentals, human purposes. Thank you so much.